Today, I want to talk about the conization procedure. This procedure means the removal of diseased tissue in the cervix in the form of a cone. When I heard it, I was scared at first, because it was scary to even think that such a situation could be related to me. But over time, I realized that this procedure can actually be performed vaginally, without damaging the uterine tissue, tubes, and ovaries. In other words, this is a treatment method, a way out. Imagine that abnormal cellular changes are detected in your smear test results. At that moment, my heart starts beating rapidly. This shows that something is wrong. Then, upon your doctor's recommendation, you undergo the colposcopy and biopsy process. If there are advanced pathological results or abnormal findings during this process, conization becomes inevitable. This procedure is truly vital, especially if there is a suspicion of cancer. Intraepithelial neoplasia, i.e., precancerous lesions, develop under the influence of the HPV virus. Types 16 and 18, in particular, are the most dangerous in this regard. This virus is found in a large proportion of squamous intraepithelial lesions. This is where the clinical diagnosis process comes into play. The process, which begins with a pelvic examination and Papanicolaou smear, continues with biopsy under colposcopic control for suspicious lesions. If there is uncertainty in these biopsies, diagnostic conizations are performed. If high-grade squamous intraepithelial lesions are detected, therapeutic conizations are also on the agenda. The conization procedure is applied in certain cases. If there are high-height or low-grade squamous intraepithelial lesions in the cervical biopsy, this procedure becomes necessary. However, it should not be forgotten that this procedure is not performed in cases of pregnancy. Because such an intervention may negatively affect the pregnancy process, there are also things to consider after the procedure. The patient can return home the same day or the next day. However, vaginal bleeding or discharge may occur within 10 days. If bleeding increases or symptoms such as high fever or pain occur, a doctor should be consulted immediately. In addition, it is recommended not to have sexual intercourse for a month. During this process, regular smear tests and colposcopic evaluations are also extremely important. Following the doctor's recommendations and prescribed medications speeds up the healing process. It is also recommended not to go swimming in the pool or the sea for at least a month. Returning to work is possible within 2 days if there is no pain or severe bleeding. In conclusion, the conization procedure was perhaps one of the most important decisions I have made in my life. I had to face my fears, but in the end, I realized how important a step I had taken in terms of health. During this process, I got to know myself and my body better. Our health comes first. Every step we take to protect our own health may save our lives. We should not forget that health is a journey, and every step we take on this journey will make us stronger.